Namaste and welcome to the Federal. In our continuing coverage of the COVID-19 coronavirus, we've been talking to people, doctors, and healthcare professionals who are right now in the line of duty, and ensuring working day and night to ensure that we people are safe. Right now, we are joined by Dr. Poovanan, who is taken time off. He's just landed from the airport, so we're going to be talking to him more, and we hope to be getting a lot of information and advice from Doctor. Uh, Doctor, yeah,
Morning.
thank you very much, Doctor. First of all, thank you very much not only for joining in this, but it's people like you, government doctors, who are taking the brunt of the risk, being right in the front. Uh, I'm sure, and your job involves screening passengers at the airport. Am I correct? So, thank you very much for that. It's a great service and duty that you're doing. So, what is actually happening at the airport, Doctor? What sort of screening and what sort of steps are taken at the airport to ensure to mitigate the spread of this virus?
Thanks for the invitation. So, I am currently with the public sector Air India, and the frontline duties are performed by the Airport Health Organization and the state health authorities. We are assisting them. So, the first point is we are not in the direct line of action, though my crew are in the direct line of action and we deal with them. The pilots, the cabin crew, and our staff who are taking care of the passengers. And it was our airlines which have brought the our students from Wuhan, passengers from Italy, and all other places. So in a way we are connected, but in the airports, all the screening is done by the Airport Health Organization, which comes under the central government, and they are ably assisted by the state government health authorities. And there are a team of doctors who are working round the clock for performing the screening. So it all started with a self-declaration form. The passengers were advised to self-declare the areas they have traveled, their illnesses, any symptoms they have, and then they were screened using infrared thermometers. So this was all the things which was done by the frontline medical team. So whenever people had any suspicions, they were advised medicines and advised self-isolation. But now we have come to a stage where it has been decided that all international passengers from most of the countries will be quarantined. So it is going to start from tonight. From tonight, all passengers who are landing in India, basically at Chennai Airport, they will be quarantined. And quarantining places are been selected in spacious areas in near Pural, in Pundamalli, and near Tambaram Sanatorium. So, and the quarantined passengers will be screened, and then uh, based on the medical assessment, they will be declared to go home, but ideally they will be advised self isolation or isolation at the quarantined areas for a minimum of 14 days.
Coming from international flights at the airport in Chennai are being recommended quarantined. Are we? Can we take that? Can we take that? That's the policy decision per se.
Yes, it
Yeah.
is from tonight. Yeah.
Okay.
Till
That's a very
yesterday, people.
important. Yeah, that's a very important thing for us to communicate to the public. So if you're traveling in to India to Chennai airport, starting from tonight, you're going to be quarantined, right? Or at least a self quarantine is what is being insisted on. Am I correct?
Self quarantine has been insisted since 2 weeks back,
Okay.
but now it is going to be a compulsory quarantine in a government area. But
Okay.
the duration of the quarantine will be decided by the medical authorities.
Okay.
It's
Okay.
not the,
Yeah. So another question, doctor. Since you are a doctor of at the airlines, I'm sure your crew, basically your pilot and your steward, and the rest who are on the plane, they also belong to a very high risk category. So, are there any particular precautions that they take, or as your role as a doctor, what would it be here in form of advice or in form of screening or testing them?
they have been trained to identify, interact, and isolate passengers So it is part of the training, and we have equipment, say the universal precaution kit, which is kept in the aircrafts, which should be used by the crew to perform these tasks. They have been trained adequately, but still they are the people on board, and they are the people who are exposed. It is basically we don't take any passenger who is toxic. So that is one screening which is being done in the airports. But whatever said and done, there have been positive passengers who have traveled, and the crew of the respective aircrafts, they have been under quarantine. Currently, they are under self isolation at their homes. It has happened like once a passenger tests positive, the state health authorities they give instructions to quarantine the crew members. So quite a bit of our crew members are under quarantine as instructed by the state health authorities.
Okay. Now, now let me move to another topic, which I'm sure is of very interest, and we all follow your writings also on this. Uh, Tamil Nadu, in terms of our public health infrastructure, do you think we are ready for such a kind of an outbreak? And another question connected to that was in terms of number of tests that are being done to determine this virus. The numbers are not very encouraging. Your comments on this?
When it comes to test, I am with the government because we cannot test for everyone, and the testing can also give a false sense of security. Because it is not that a person who lands and we test him within 24 hours, within 48 hours, and he tests negative. It is not that he will not get the disease. And based on minor symptoms, because more than 80% of the uh,
Asymptomatic,
there's
yeah.
patients who are getting the illness, it will be morely asymptomatic or a mild cough. It will go away like a common flu, and that is the reason the government is a bit strict with the testing. And I will not say I will not be against that. But when it comes to the preparedness, I would have preferred more amount of preparedness. It is always like when I'm in a department, so whenever there is an issue, I will try to augment my department. So all the shortages in the department could have been filled. We could have filled the all the shortages of medical personnel, paramedical personnel, recruited more. That would have given a massive morale booster because it is all a team of youngsters, and they would have been trained specifically for weeks on managing epidemics, and that would have been a huge manpower. I think both the central and state governments can do that even now.
So what you're essentially saying is the government should go out and fill on a war front basis all these unfilled posts, government posts, and especially it could be doctors, it could be nurses, uh, probably even ambulance drivers. It could be any, because we see that a lot of these posts, which are actually sanctioned posts with the Ministry of Health, have not yet been filled. Right? Is that what you're suggesting, Doctor?
Yes, and the age limit of the doctors of retirement has also increased. So we have got an increased age group of doctors. So the recruitment, there has been a bit of a standstill when it comes to recruitment of medical personnel, and we could have used, and we can still use this opportunity to recruit a huge army of doctors. They are they are mandatory here because we are going to live with viruses, and these sort of epidemics can be managed mostly by the governmental agencies. So that is my feeling as well as my humble suggestion.
No, I think that's a
And
very, very valid suggestion, and I hope people take this seriously. Uh, just about last one or two questions. So, in terms of preparedness per se at Tamil Nadu, where do you think we are? What are all we are keeping hearing multiple things. What else can be done right now? I do agree to your point on doctors and nurses and filling up the human resource. But other than that, what else do you think involving private hospitals, for example? You said it is government. Involving, say, private labs or private hospitals at this stage is something which should also be allowed.
yes, Tamil Nadu has got a very robust private labs, private hospital setup, and they should be harnessed fully. We can have earmarked hospitals. The government can take over entire hospitals so that they can be earmarked. It can be a government or a private hospital specifically for these cases because there are millions of people who are undergoing treatment every day. So clubbing them with these patients and having them as a separate ward, entering the same hospital premises, those all things also can be avoided. It can be specific hospital for the specific problem. separate ambulances specifically meant for taking patients who are suspected to have sort of a contagious disease like corona. So that can also be planned. That will make the situation more better. So we have a very robust private medical setup, and they will be more than willing to help us in Tamil Nadu.
I think very, very true. Just before you, we wanted to get another. We had somebody from the private medical hospital to be a joint session, and we thought we'd encourage. But I think this is very, very encouraging when this is coming from you. Uh, Last question. Um, what next? We are right now at a stage where about 150 cases have come out. The rate of infection is rate of reported cases increasing. Uh, Things like social distancing and closing down schools and public places have been done. What next? What next do you think should policymakers be looking at and doing?
They should take care of the people who will be left out now. Because say someone is sick, he has to be going to the hospital. So he needs an auto, he needs a public transport, he needs something, and those has to be operated. The hospital staff has to function. So it may be ideal to have a setup where the doctors who are earmarked for managing these cases, they are being also some sort of a quarantine, in the sense they are staying at a place which are nearer to a hospital. Say the government can take over hotels which are also empty now, and they can pay the hotels, so that one hotel is fully meant for managing the paramedical medical staff. Because like a crew who is exposed, a doctor is also exposed, and he is exposed in a very closer manner. It's not that the medical paramedical personnel they have some special immunity. So that is one thing where which has to be done on a war footing. So if that is done, then I feel like our situation, our exposure to more number of viruses, our immunity against viruses, and the climate, humidity, all these things can play a role and can help us in preventing any calamity like what has happened in other countries. I hope so that we will not suffer like those countries, but we can use this opportunity as a learning experience so that we overcome all the shortfalls in the healthcare system. And I will be more than willing, like we do something like Cuba. We get people and treat them, because I heard that people who are old, they based on the age, the ventilators are being given, treatment was being given in intensive care unit. Hope all those situations will not happen in future, and I am sure that it will not happen in Tamil Nadu and in India.
Very true, doctor. In every adversity, there is an opportunity, and instead of being cowed down by adversity, what you say is correct. We must look at opportunity and see how we could ramp up our public health system so that we are not going to face this in the future. Thank you very much for joining us live on this show, and we hope that we get more opportunity to talk with you on this. Thank you once again. Uh, Thank you. Continue to watch
Thank
our continued coverage on the COVID-19 coronavirus on the Federal. Do follow us on our YouTube channel, on our Facebook page, and our Instagram handle. Namaste, and you're watching the Federal.